Hello and welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director of the Murray County Medical Center, and I'm here with Lindsey Sell, one of our nurses in the Rural Health Clinic, and we're going to be talking about immunizations on this episode. Hello, Lindsey. How are you?
Good. How are you?
I'm good, thanks. For those of our listeners who haven't listened to your previous episode that you were on, why don't you take a minute and introduce yourself?
All right. Well, I'm Lindsey Sell again, one of the clinic's nurses, and as I was in the last podcast, I am a certified lactation consultant and also graduated through a Stanford program called VaxChamp. So I did that 4 or 5 years ago, and I've just kind of kept up with that over the years.
Cool, thanks. And so August, for those of our listeners that don't know, it's National Immunization Awareness Month. It's kind of that back to school time for a lot of folks, getting ready for the new year. Can you talk a little bit about the importance of this observance and kind of why it's important to stay up to date on recommended vaccinations?
Sure. Yeah, so again, like you said, it's back to school, so I think August is a really good month for that, just because a lot of kids, don't come in always for their well child during their birthdays. They kind of all do it back to school when they get those letters that say you're due for stuff. So I know that's probably why they do it in August. When it comes to children's health, especially, it's better to prevent a disease than it is to treat it once you've contracted it, which is why vaccines are so important. And some of the vaccines that are in the recommendations, such as smallpox, polio, measles, varicella, pneumonia, all these vaccines are just great ways to help prevent you getting this disease, and some of them can be deadly, which a lot of them are eradicated now because of vaccines, but I mean they still can present themselves in communities that aren't vaccinated and underserved areas, stuff like that. When you're an infant, you're kind of born with some of your mother's immune system, but that wanes really quickly over the first year, and so that's why it's just really important to stay on top of those vaccines from birth up until forever, really. It's just nice because that wanes really quickly, and then you need to kind of build your own immune system up.
For sure, definitely. And you touched briefly on well child visits, and just for kind of the lay person's definition's sake, I mean, there's well childs, there's sports physicals for your older kids. Just to define some of those important terms, can you kind of differentiate if there are any differentiations between those?
Yeah. So well childs are something that for the most part insurances cover. Your first couple years, you kind of go through them fairly quickly. You do one 1 week, 1 month, 2, 4, 6, 9, 12, 15, 18, 24 months. And then after that, and then 30 months now too, they've added that one. And then after that, insurance covers them annually for up until you're 18. And there's really good visits to check off the immunizations if you're due, checking your hearing and visions, doing any recommended questionnaires and stuff like that. It kind of helps you just make sure that your kid is developing correctly, with their motor skills and their developmental stuff. And it's stuff that you just might miss, and it's just an easy check to make sure all that stuff is going appropriately, because you don't know how well your kids compare to the average child. A lot of parents, you go to things and you're comparing your kids to this one and this one, and you might think they're way ahead or way behind, but really they're kind of right where they need to be, or maybe they are, and then we can help reach out to the appropriate services. And then mental health and stuff like that, we kind of miss kids and stuff like that. So I think the yearly checks for that, just to make sure everything's kind of kosher for the kids, is a great opportunity for that.
Perfect. So seems like it's kind of the well child in particular, along with the insurance component of it, might be a little more comprehensive than, say, a normal sports physical. Yeah, sports physicals kind of, there's a paperwork that's due, I think when they turn in 7th grade, as long as they're going to be in activities.
That's like every 3 years, and really it's kind of just a checklist. I mean, they definitely make sure your body is ready for sports, but that really is focused mainly on like activity and if you're able to do activities or like contact sports and stuff like that. So it really doesn't touch on everything that you would need. And again, those are for only like every 3 years once you start in 7th grade, and only for people that are going to be in activities. So I mean, there's a lot of kids that can get missed for that, and so we don't ever want to rely specifically on like a sports physical to get you through your whole high school career, because there's just a lot more we can touch on.
Perfect. Thanks for that clarification. And kind of going a little bit back to immunizations, I think you touched on it a little bit in your first response. How do those immunization recommendations kind of change depending on the various life stages, like from infants to maybe all the way up until the elderly, for example?
Yeah. So, I mean, there's a big difference. So, infants and children's are basically starting from a blank slate, besides the immunity that they get from their mom that kind of wanes really quickly. And so we're really just prepping their immune system for all of these diseases once they are birthed. So from birth to age 4, you're due for 26 components of vaccines, which is, a lot of them are boosters. So like polio, you have to get 5 doses of polio, and pneumonia you have to get 5. Diphtheria, you're getting tons of them, and pertussis and stuff like that. Varicella and MMR, you're getting an initial one in boosters, and so you're really just getting your body ready or prepared to fight any of these if you were ever exposed to them. And then so from birth to age 4, you're really getting a lot of components just to build that immune system up. And then afterwards, you're really just boostering everything, so just making sure it's still effective in your system. Birth to 18, there's a lot of vaccines that are required for school and daycares and stuff like that. When you're a teenager, there's like 3 or 4 extra ones that you didn't get as a child that you're due, and then there's also recommended. Once you get to like the older population, it changes a little bit. Some vaccines are more than required based on like lifestyle choices. Like if you smoke, we're going to give you a pneumonia vaccine when you turn 18 years old, 19 years old, and we're going to booster you, and we're going to give you them a little bit more often than, let's say, somebody that doesn't smoke. They're not going to get one until they're 65. There can also be some health conditions like lung disease, immune disorders, diabetes, cancers. Those people are going to get more vaccines than the average healthy adult. And so stuff like that. But I mean, everybody in general, once they get to be the age 50 to 65, they're all going to get those vaccines, but there's just a lot more health conditions that play into factor when you get to be an adult versus a kid who's just everything, you just got to get it in there. That's the biggest difference. And the 2 vaccines that I want to touch on is the shingles vaccine and the tetanus vaccine, which I think that are a lot of vaccines that people don't regularly get. Tetanus is a vaccine that's due every 10 years, 5 years if you ever have an injury, and I think that kind of falls off of people's radar, and especially when you get to that older population. Insurance wasn't originally covering those, but now as of January 1st, 2023, Medicare Part D is covering the shingles and the tetanus vaccines at pharmacies, which they weren't previously, and they were fairly expensive. So that's a big thing that I wanted to touch on, that people can get those now. They don't need to be worried about all these charges and stuff. It's just really good vaccines to keep up on.
For sure, definitely. And as I touched a bit on earlier, August is kind of that back to school time, heading into the classroom, maybe going back to daycares for some kids. Are there any specific immunizations that are particularly important for those considerations when kids are heading back into school and kind of being around all those people and whatnot?
I think with the annual flu shot and the COVID vaccines recommendations changing so frequently, every year is really an important year to get your kid in for their preventative vaccines and well childs. However, there's some initial series that you get from, like I said, birth to 2, and then probably the most important years that you are going to want to for sure get in are those 4 to 5 year olds. They kind of get those initial booster shots. To going back to school when you're really starting school. They just want to make sure your immune system is good. And then also, once you turn 11, you'll get a couple more. Like that's when you get your last real booster, to be fully immunized against the tetanus, diphtheria, pertussis, which is called the Tdap, and that's the one that you're going to want to keep up every 10 years. And then you also start your series of meningitis at that age. But then HPV is also another vaccine. It used to not be approved until you were 11. So again, 11 was that really good year to get in because you're due for 3 shots. However, they've lowered that age to age 9. So there's just so many vaccines that you can get at any given well child. So I think it's super important, besides all those other reasons I mentioned before, just getting in for the annual check. We can keep you up to date on everything. We can just make sure everything's kosher so you don't have to, get to school that first week and then all of a sudden you're like, oh, you're due for five vaccines. We need you to go home until you get those in.
For sure. And you've mentioned a lot of different vaccines. Kind of to start wrapping up here, what kinds of immunizations are regularly available in the clinic here at MCMC, and what's the process for getting those? Do people need to call for an appointment? Can they just walk in? That sort of thing.
Yep. So we at MCMC do stock all required and recommended vaccines for people for birth up to the 65 and plus. Just like influenza, COVID, shingles, pneumonia, hepatitis A, hepatitis B, all those vaccines. The only vaccines that we don't keep on stock here, which I don't think really there's a whole lot of clinics that do around here, are vaccines that would be due for travel. So your yellow fever or typhoid, stuff like that, which we can direct you to the nearest traveling clinic. But those are really the only vaccines that aren't readily available here. Again, like I've touched on a few times, we do recommend for anybody under the age of 18, if they're due for vaccines, they're probably due for a well child. So we'd probably just recommend getting in for the well child, and then we can update their vaccines at that time. However, we never want to miss an opportunity to vaccinate somebody. So if you're coming in for an acute reason, as long as you're not ill, we're going to ask you if you want to update your vaccines. And then for those, for the adult population, same thing. If you're coming in for your med management, we're going to ask you. But if you're coming in for an acute thing that you're not ill for, we're going to ask you then too. We also do have walk-in COVID vaccines all throughout the year. Flu shots during flu season, we have walk-in at that time. And then if you ever have any questions on whether you're due for vaccines or if you truly need an appointment or if you can just walk in, you can always call us, and any of us nurses can help you with that, just to see what's appropriate for you and how the visit needs to go about.
Perfect. Sounds good. And do you have anything else to add before we wrap up?
Yeah. I guess there's just a couple things. Vaccines are constantly changing, and they're coming out with new vaccines every single day. It changes every day. I can read something every single day about something that I didn't know the day before. Some of the things that I'm super excited about are the RSV vaccines, and they have came out with an adult RSV vaccine for those patients that are 60 and older that we're going to be able to start giving this fall, it's just amazing. And recently they have just approved it for infants as well. And RSV is such a deadly virus that there really isn't good treatment for, and it keeps our hospitals full everywhere. And it's just such a scary virus, and it's amazing that they're coming out with this vaccine that's going to help. I just feel like it's just going to make such a huge change in the healthcare industry. I can't wait to see how this vaccine is going to change all of that, and just the fear that parents have when their babies are born during the RSV season. I just think it's going to be amazing. And for those elderly patients that just can't fight this, like the healthy 20-year-olds can. And like I touched on before, just that Medicare Part D has changed, so vaccines are now covered. I feel like that hasn't been like super advertised, so the elderly population kind of get nervous about updating vaccines and the cost, and that's just a great change. And vaccines, just to me, they're just amazing. I'm just blown away about how that they can completely eradicate things that killed tens of thousands of people just decades ago. And I continue to read and research vaccines every day, and I'd be happy to help anybody with any questions and get on all of my soapboxes about vaccines and answer any questions anybody has.
Perfect. Thank you for being here, Lindsey.
Thank you so much.
And if you have any questions about anything that Lindsey has mentioned, if you want to find out if you're due for any vaccines, or if you'd like to make an appointment at the Maury County Medical Center, you can call the clinic at 507-836-6153. That's 507-836-6153.